One of the things that is very, very difficult sometimes is to explain to someone that we got to take that time to evaluate it, right?
Right. I mean, oftentimes because this person is either dealing with it or they've, dealt with it, they're like, I know I have a case. This is it, blah, blah, blah. And while I commend them for that, we still have to do our due diligence on our end. And like you said, we actually are required by New York state law to speak with a physician, and we file what's called a certificate of merit when we file suit in a medical malpractice case, which is different from any other type of personal injury case. So we actually have to swear that we spoke with a physician and that a physician says, yes, there is a case.
And some of these cases that we have, it's not necessarily on an elderly person, all right? Because it's not only elderly people that get cancer. It literally could be someone from all different ages. Yep. And, different cancers are more prevalent with regard to people of different ages, but it's not necessarily the case. And, we have a client, and we have many clients, but, we're handling cases of ovarian cancer. And ovarian cancer can be devastating. Yes. Be absolutely devastating for someone. And, we encourage all you women out there, please make sure that you get your regular checks.
Yes, please go get your yearly exams, get your pap smears, push for everything that you can. If you think something's off, you need to make sure that you let that be known to your physicians.
Right, because our hope is that we would never, ever have to hear from you, okay? Yes. But make sure, though, that you're taking care of your part of it, okay? And that's also important because, when we have a case, one of the defenses, Amanda, with regard to a case in terms of whether or not a doctor or physician is liable, is taking a look in terms of whether a patient had symptoms and failed to otherwise now go ahead and go to a medical provider, right? Right,
exactly. If you don't go to a medical provider and you think there's something wrong, there is no failure to diagnose or misdiagnosis if you never went. So you need to be proactive about your own treatment and make sure that, you're getting the care and treatment that you need.
Right. And we want you to be proactive first and foremost because we want to minimize any possibility that you can have a serious illness or have the disease at a stage where it's going to be much harder to deal with. But the realities are that it's important. Get the testing. So whether it's your yearly gynecological exam, please don't put that off. Whether it's your yearly exam concerning a different type of cancer. And, if you're more susceptible to certain types of cancer, you may be on a different schedule.
Right.
We have clients that, for whatever reasons, they have a family history, and their doctor may want to see them more often. Their doctor may have done a pap smear, and that pap smear may have shown some type of irregular cells, and it may not mean that you have cancer, but it may make you more susceptible for the possibility. So listen to your doctor, get that direction. And if you don't think your physician's paying attention, okay, that's a warning right there. Go to somebody that is paying attention. Many really wonderful doctors, physicians, people who really do care. And if they seem too busy for you, my advice to you is then get somebody else. Get somebody who's going to take the time because you never should be too busy to get it right.
Right.
And so we've had cases over a course of time where when we look at it, when we ultimately analyze it and say, well, how did this happen? How did this get missed? Some of the factors that come up is either someone is too busy and they really didn't pay enough attention. Someone is not listening to your complaints. Mm-hmm. They're not a person who listens. Mm-hmm. And those factors, the human factor, cannot ever really be ignored because the fact is that we don't believe anyone intentionally. There's no one that's intentionally wants to make you to have or get cancer. Mm-hmm. But those factors are people not taking the time, people not looking at the records, people not listening to your complaints, people not having a willingness sometimes to think outside the box. So we've had people who have been making complaints, and that doctor maybe has been doing the same thing year after year after year, and they've been what they call a little long in the tooth. I mean, in other words, they've been doing it for a long time and are not keeping up with the most recent types of tests and most recent types of information. And so now you're not getting the best care. And so in that situation, we've had cases, sadly, where because of that really is really what probably made their situation worse.
Right.
So we don't want that to happen to you. Our show, of course, is if you are hurt, please come to us. Give us the opportunity. We'd love to try to help you. But we try to encourage also on our show ways to avoid there being incidents, ways to avoid there being car accidents, ways to avoid there being incidents of malpractice which are not diagnosed. Okay, we're not looking for business that we don't need to have. We don't want you to be injured, but if you are, Amanda, it's our privilege, right, to represent them.
Yes, and please give us a call, 654-4900.